Hello everyone, welcome back Excel MRB orientation classes. Myself MohammadNaushad. This is my second orientation class regarding anatomy. Okay, let's focus some of series of the MCQ questions and its answers. I have taken very basic questions with the answers and explanation. With your all the coordination, everything, please try to answer the questions. Let's go to the topic. Here comes first question. Question number 1. What is primary function of rotator cuff? What is primary function of rotator cuff? That is muscle. Option A, stabilize the shoulder joint. Option B, flex the elbow. Option D, extend the wrist. Option D, rotate the hip. Read carefully the question and answers, then try to answer me. Have a glance on the screen, please. Yeah, many people are trying their best to answer. Moving on. We'll now see the answer. Answer is option A. Stabilize the shoulder joint. Many people have answered the correct answer. Explanation. The rotator cuff consists of 4 major muscles. That is supraspinatus, infraspinatus, subscapularis and teres minor. Answer, like, apart from this function, that is stabilizing the shoulder joint, rotator cuff muscle also help in the rotation of the shoulder joint. If they're asking any kind of questions, given option like stabilize the shoulder joint plus rotation of the shoulder joint, this also might be an correct answer. Or they're asking separately these two questions, might be the answer will be same. Moving on to the next question. Which joint type allows for the greatest range of motion? Which joint type allows the greatest range of motion? Option A, hinge joint. Option B, ball and socket joint. Option C, pivot joint. And option D, saddle joint. Have a glance. We'll be back soon. Many people are trying their best to answer, but some have got confused between those answers. Let's go to the answer session. Answer is option B, ball and socket joint. Here, ball and socket joint, like the shoulder joint and the hip joint, allows the motion in the all the multi-direction things, not only one single direction things. Whereas hinge joint allows in only one plane. Example of hinge joint might be like elbow joint plus knee joint, where they allow other like flexion, extension, supination, pronation, like this only one particular plane they are going to think. That is hinge joint. If you see the pivot joint, example should be like neck. Best example is like neck. Here it having direction in only one axis, whether they are going to rotate. One more example will be like radius and ulna, where it's going to do help things. And ball and socket we have discussed, that is like all the multiple direction things. Whereas option D is saddle joint. Saddle joint, like see, carpometacarpal joint are the examples. Then sternoclavicular joint is an example, where whether they can do flexion, extension, adduction, abduction, like the motions. So they may also ask in MRB like what are the example for the hinge joint type and which movement is going to come under the hinge joint. Likewise, all the joints, all the types they may ask. So have a glance on this. Next, Moving to the third question. What is the primary function of the skeletal system? Primary function of skeletal system. Option A, produce hormones. Option B, store energy. Option C, provide structure and support. Then option D, facilitate digestion. Have a glance. We'll be back. Miss Usha Ravichandran, Prabhakaran, Shalu, Sarvanan Kumar, thank you for your feedback and the cooperation. Maximum people have answered the correct. Okay, we'll go to the answer session. So answer is option C, provide structure and support. Here you can see a skeletal system diagram where the skeletal system provides a framework for the body which supports the organs and facilitate the movements. With the help of this skeletal system, we are able to give a framework structure for our body, then say it's supporting the organs and helps to the do movements. Apart from this question, like we have other three options. What does those option does? Like for example, produce hormones. Which system in a body will produce the hormones? Definitely the answer should be like endocrine system. Endocrine system will produce the hormones in a body. And which part or which system stores the energy? Energy is stored in form of ATP or lipids, where it is stored in the muscle. So musculoskeletal system. It will be musculoskeletal system. Then provide structure and support. That is the question. That is skeletal system. Then facilitate digestion. Name indicates which system will provide. Of course, answer will be like digestive system. This should be digestive system. I hope I am very clear. Then moving on to the next question. What is the primary role of synovial fluid? What is the primary role of a synovial fluid? Option A, provide nutrition to cartilage. Option B, lubricates the joints. Option C, absorb the shock. And option D, protects against the infection. Have a glance. We'll be back. Yeah. Going to the answer session. So the answer is option B, lubricates the joint. Synovial fluid reduces the friction between the articular cartilage of synovial joints during the movements. Synovial fluid is a like clear, pale yellow color fluid which is present in all the synovial type of joints. How? For example, this is a diagram of knee joint. Here you can see femur bone and here you can see tibia bone. In the edges or in the end lower ends of the each bone, like this lower end and its upper end, we have an articular cartilage. Here also you can see an articular cartilage. In between these two articular cartilage, we have a fluid that is called as synovial fluid. What does this synovial fluid does? It helps to lubricate the joint as well. It will reduces the friction between the articular cartilage. When two bones comes together without any synovial fluid, there will be a creepy sound. In case if there is any kind of space, in that space we have an synovial fluid. It does the lubrication so that the movement can occur very easily without any harmful thing or without any creepy sound or movement. I hope I'm very clear. It does not provide the nutrition for cartilage. It does not absorb the shock, or it does not protect the infections. So answer will be lubricates the joint. Next, moving on. Question number 5th. Which part of the brain is responsible for regulating the body temperature? Which part of the brain is responsible for regulating the body temperature? Option A, cerebrum. Option B, hypothalamus. Option C, medulla oblongata. And option D, cerebellum. Have a glance. We'll be back. Yeah, many people are trying their level best. Nitya Ayappan, content creator, Sneha Prabhatar, then Snehal, Usha, Ravichandran. Maximum people are trying their level best. Okay, we'll move to the answer session. That is, our answer is option B, hypothalamus. Hypothalamus plays a key role in maintaining the homeostasis, including the body temperature. Along with this, apart from body temperature regulation, hypothalamus also does a key role in sleep pattern, cycle of sleep. That is sleep. Like, what about other organs? What does they do? Like, for example, cerebrum. Cerebrum plays a major role in cognition, problem solving, memory, etc. Whereas medulla oblongata is a like respiratory center. It is a respiratory center of a body. Cerebellum, it plays a major role in balance and coordination. It plays a major role in balance and coordination. They may ask like this also, like, which is the respiratory center of a body? That is medulla oblongata. In like one of the MRB things, one of the exam things, they have asked which part of a body is called as respiratory center of a body. That is medulla oblongata. I hope I am very clear. Moving to the next question. What is the primary role of lymphatic system? What is the primary role of lymphatic system? Option A, transports the oxygen. Option B, removes the waste products. Option C, regulates the blood pressure. Then option D, defends against infection. Have a glance. Read question properly. What is the primary role of lymphatic system? We are getting mixed answers. Okay. Moving on to the answer session. The correct answer is option D. That is defense against the infection. The lymphatic system plays a crucial role in immune function by transporting the limbs which contains white blood cells. That is WBCs. Lymphatic system consists WBC, which plays a defense mechanism against the infection. What about other things? Like option A, I have said is like transport oxygen. Which part or which system does this work? Does generally we know this oxygen is carried by blood, so blood comes under circulatory system. They may ask like this also. What about waste product? We know very clearly it should be like excretory system plus respiratory system. Both does helps in doing removing of the waste product, regulating the body temperature, body pressure. Even this was asked in previous year question, like which part of the body or which system regulates the blood pressure. Your answer should be sympathetic nervous system plus kidney. These two things helps in regulating the blood pressure. And option D was defense against infection will do by lymphatic system. Okay. Moving to the next question. Okay. Which nerve is responsible for sensation in the anterior thigh? In the anterior aspect of the thigh. Option A, sciatic nerve. Option B, femoral nerve. Option D, obturator nerve. And option D, tibial nerve. If you have listened or if you have attended my previous class, you would have noticed this thing. I have explained there. Have a glance, will come. Okay. Moving to the answer. Answer is femoral nerve. Femoral nerve innervate the quadriceps muscles and provide the sensation in the anterior aspect. They may ask like which compartment supply what are in the muscles, which nerve supplied by which muscles, or which muscles are supplied by which nerves. Just I'll give an intro. Imagine this as our femur bone, a transverse section of a femur bone. This as an outer covering layer skin. Beneath the skin, we have fascia, that is superficial fascia. Beneath the superficial fascia, we have deep fascia. This is skin, superficial fascia, deep fascia. Okay. Now what happened? This is anterior aspect, posterior aspect, medial, then lateral. From the deep fascia, it's gonna divide and merge. Here we can get anterior compartment, this posterior compartment, and this is medial compartment of the thigh. This is a cross section area of our thigh. Okay. Now anterior compartment is supplied by femoral nerve, which all the muscles comes under the anterior compartment of the thigh, is supplied by a single nerve, that is femoral nerve. And which all the muscles which are coming in the posterior compartment of the thigh is supplied by sciatic nerve, that is sciatic nerve. The muscles which comes under the medial compartment are supplied by obturator nerve. Obturator nerve. So femoral nerve, they have asked like anterior thigh. So anterior thigh should be, answer should be femoral nerve. What about other things? Which muscles? They may, now they have asked about which nerve is supplied. They may even ask anterior compartment of thigh includes which muscle? Posterior compartment of thigh includes which muscles? So our answer should be anterior compartment includes sartorius muscles, quadriceps muscle, then articularis genu. That should be sartorius plus quadriceps plus articularis genu. This comes in the anterior aspect. What about posterior aspect? It includes hamstring muscle, all the hamstring muscles, plus adductor magnum, plus adductor magnus. Then about going to the medial thigh, medial compartment, it includes totally 5 muscles: adductor longus, adductor brevis, then adductor magnum. Then we have a like gracilis muscle plus pectinis muscle. These are the muscles which comes in the um, uh, like in the thighs. So anterior thigh is supplied by femoral nerve, posterior thigh is supplied by sciatic nerve, medial thigh is supplied by obturator nerve. Anterior thigh consists of sciatic sartorius muscle, quadriceps muscles, and articularis genu, whereas posterior compartment consists of hamstring muscle with additionally adductor magnus, that is ischial head. Here in the medial side, we'll get adductor longus, brevis, magnus, then gracilis, and we have pectinis. Moving to the next question, what is the main function of the meniscus in the knee joint? What is the main function of the meniscus in the knee joint? Option A, provide the stability. Option B, observe the shock. Option C, facilitate the movement. Option D, produce synovial fluid. Have a glance, we'll be back. Yeah, many people are trying their best to answer. As we know, this is very basic concept. So the answer should be option B, shock observer. As we know, like for example, see, this is knee joint. Here we have femur bone plus here we have tibia bone. At the both the ends, that is in the tibia, we have like medial condyle and lateral condyle. These medial and lateral condyle has two parts: central concave part and peripheral flat part. On the peripheral flat part of the medial malleolus, like that is sorry, medial condyle, medial or lateral condyle, we have a special structure that is called as meniscus. These meniscus provides or does a function called shock observer. Whenever a force is coming from upside and the downside, these meniscus will act as an observer. They're going to equalize the amount of shock, they're going to equalize the amount of force, so that we can able to stand or so that we can able to walk. This is a main function of uh, meniscus. There are two meniscus, lateral meniscus and medial meniscus. They may even ask like where does meniscus are present and what are the types of meniscus by giving the options. Okay. Moving to the next question. Okay. Which part of the vertebral column is most mobile? Which part of the vertebral column is most mobile? Option A, cervical vertebra. Option B, thoracic. Option C, lumbar. And option D, sacral. Have a glance. Which part of the vertebral column is most mobile? Option A, cervical. Option B, thoracic. Option C, lumbar. Then option D, sacral. Okay, moving to the answer session. Answer is option A, cervical. Cervical region allows a wide range of motion, including flexion, extension, and the rotation. But where we compare to the other vertebrae, it does not allow all the movements. If we compare, cervical has greatest range. Cervical vertebra is more mobile. Then thoracic is little lesser. Then lumbar has more lesser. Then sacral is less. So in the direction of this, we can easily identify which vertebra has more mobile. So answer is that cervical vertebra. But whereas other, they also are mobile, but well compared to the cervical vertebra, it's very less. 11th question. What is the primary role of anterior cruciate ligament? What is the primary function of anterior cruciate ligament? Option A, prevent hyper knee extension. Prevent knee hyperextension. Option B, stabilize the shoulder. Option C, prevent the tibial translation. Option D, supports the ankle. Have a glance. What is the primary role of anterior cruciate ligament? Option A, prevent the knee hyperextension. Option B, stabilize the shoulder. Option C, prevents the tibial translation. Option D, supports the ankle. Okay, fine. Moving to the answer session. Before moving to the answer session, let's discuss like how to answer this in very common thing. We know that anterior cruciate ligament is present in the knee joint. We have like anterior cruciate ligament, posterior cruciate ligament in the knee joint. Option here I have given is 4 options. Option A is prevent the knee hyperextension. Option B is stabilize the shoulder. Here we can see, like as I've said, ACL is present in the knee. Can this be an answer, that is stabilizing the shoulder? Of course, it's not a correct answer. It's not present in the shoulder, so answer will be not wrong. It will be wrong, sorry. Then option D, supports the ankle. It's not present in the ankle, so it does not support the answer. There are only two options are left over. That is option A, prevent the knee hyperextension. Then option B, prevent the tibial translation. Among these things, any one might be correct, any one might be wrong. Like have glance which correct answer. This is an option. Many people were saying A, C, A, C, but like they are confused between A and C. Yeah. So the answer is option C, prevents the tibial translation. It does not prevent the hyperextension, but it prevents the tibial translation. ACL prevents the tibial translation from sliding forward relatively to the femur, stabilize the knee. Like tibia should not slide slightly forward from the femur, so that it also provides the stability to the knee. They may even ask an option they may also give an option calling prevent the tibial translation plus stabilizing the knee. Stabilizing the knee. Generally, we know, like, it's very common question. ACL is used for, all the ligaments are used for stabilize the particular joints. So ACL is used to stabilize the knee, but in this option they haven't mentioned stabilize the knee, but they have mentioned a little differently, that is prevent the tibial translation. So the answer is prevent the tibial translation. Next, which nerve innervates the diaphragm? Which nerve innervates the diaphragm? Option A, vagus nerve. Option B, phrenic nerve. Option C, intercostal nerve. Then option D, sciatic nerve. Have a glance, will become. Which nerve innervates the diaphragm? Option A, vagus nerve. Option B, phrenic nerve. Option C, intercostal nerve. Then option D, sciatic nerve. Many people are trying. Mohammad Usman, Sri Charan, Darshini, Puni, Shalu. Many people are trying their level best. Still, please try. I need more answers. Yeah. Going to the answer session. The correct answer is the phrenic nerve. Here you can see we have a like phrenic nerve which is supplying the diaphragm, which is doomed shaped muscle is supplied by a nerve called as phrenic nerve. Which helps in during breathing. Then what about other remaining nerves? What does they do? For example, option A, vagus nerve. It supplies to which part? It supplies to heart, lungs, pharynx. These many things vagus nerve is supplied. Intercostal muscle name indicates it supplies to the costals, that is ribs. Whereas sciatic nerve, just now we have discussed, it supplies to the posterior compartment of the thigh. I'll explain. Vagus nerve supplies heart, the lungs, and the pharynx. Phrenic nerve supplies to the diaphragm. Intercostal nerve supplies to the ribs. Sciatic nerve supplies to the posterior compartment of the thigh. Moving on to the next question. What is the primary function of the intervertebral disc? What is the primary function of the intervertebral disc? A, provides the stability to the spine. B, allows the spinal rotation. Option C, observe the shock. And option D, facilitate the nerve transmission. Have a glance, we'll discuss. Yeah, super. Many people are trying their best. Yes, Usha Ravichandran, HRJ, Krishnaveni R. You're trying best. Here also I can get many mixed answers. Like observe properly. Like what is the primary function of intervertebral disc? Option A is like provide the stability to the spine. Option B is allow the spinal rotation. Option C is observe the shock. Option D is facilitate the nerve transmission. I'm getting many mixed answers. Fine. Going to the answer session. The answer is option C. Observe the shock. Same like we have already discussed regarding the meniscus. Here also it provides same thing. That is like observe the shock. Intervertebral disc act as a shock observers between the vertebra, allowing the flexibilities and the movement of vertebra. So here you can see the intervertebral disc in vertebral body 1 and vertebral body 2. We can take any example, cervical, lumbar, thoracic, whichever thing, just likewise. In between these vertebral bodies, we have a small area or a small disc that is called as intervertebral disc. Same what happens when two bones combines together, they may form a creepy sound. But here we have an cushion like structure, that is intervertebral disc like structure. They are placed in between the two vertebral body. What happens, amount of force coming from upside, then amount of force coming from downsides comes in and join in particular point and equalized, so that the movement can be occur very softly, very easily. In case if this intervertebral disc here and the meniscus in the knee are absent, what happens, it does not allow the movement easily, so we get many kind of things, many kind of disorders. Here this intervertebral disc, its like structure is here. It has two parts, that is outer annular fibrosis and inner nucleal pulposus. Inside we have nucleal pulposus and outside we have annular fibrosis. If there is any damage to this particular body or this annular fibrosis, the nucleal pulposus might get leaked, so we can get intervertebral disc prolapse. So what is the primary function of intervertebral disc? That is observe the shock. Moving to the next question, that is what is the primary role of the iliotibial band, IT band, that is iliotibial band? Option A is stabilize the knee. Option B is flux the hip. Option C is extend the knee. And option D is supports the ankle. Have a glance. Aisha Nazia, Krishnaveni, Muttu Lakshmi, many people are trying their best. Thank you so much. Thank you, HRJ, for saying good explanation, sir. Once again, I'll read the question. What is the primary role of iliotibial band? That is, stabilize the knee, flex the hip, extend the knee, supports the ankle. Okay. Going to the answer session. That is, our answer is option A, stabilizing the knee. The iliotibial band provides the lateral stability to the knee during the movement. Whenever a person is able to move, the iliotibial band is present in this area. It's going to give an lateral stability. So option is A. Here you can see this iliotibial band starts, that is originate from the hip joint, comes downwards and attached to the knee joint. So whenever we are moving, whenever a person is able to move, it provides the stability to the knee. So answer was stabilize the knee. Moving to the next question. Which muscle is responsible for movement of scapula? That is like squeezing movements of the scapula. That is option A, trapezius muscle. Option B, latissimus dorsi. Option C, rhomboides. And option D, both A and C. Have a clear thing. Which muscle is responsible for movement of scapula? I have given option A as trapezius, option B as latissimus dorsi, option C as rhomboides, option B as, that is both option A and C. Have a glance, we'll discuss. Like this also they may ask in MRB questions, like they may get confused between which muscles they are giving. Here I have mentioned option D as both A and C. So have a clear thing. Many people have said like correct answers. Still I want more answers, please. Okay, okay. Thank you so much. Answer is option D, both A and C. That is, option A is trapezius, option C is rhomboides. These two muscles, trapezius muscle plus rhomboides major and minor muscles, helps to the movement of the scapula. Then what about this latissimus dorsi muscle? Any idea? Like anyone can comment, please. What is the function of latissimus dorsi muscle? Like I have said, the movement of the scapula is done by trapezius as well as rhomboides muscle. But what about this latissimus dorsi? Any answers, guys? Yeah. Thank you. Okay, the answer should be extension plus adduction plus medial rotation of the shoulder joint. This is a function of latissimus dorsi muscles. What are those? That is extension, uh, adduction plus medial rotation of this shoulder joint is a function of latissimus dorsi. Moving to the next question. What is the primary role of diaphragm during the respiration? Previous question I have asked which nerve is supplied to the diaphragm. That was phrenic nerve. Now I'm asking a question, that is, what is the primary role of the diaphragm during respiration? Option A, expanding the thoracic cavity. Option B, compressing the abdominal cavity. Option D, elevating the ribs. Option C, decreasing the lung volume. Have a glance and we'll come. What is the primary role of diaphragm during respiration? Option A, expanding the thoracic cavity. Option B, compressing the abdominal cavity. Option C, elevating the ribs. Option D, decreasing the lung volume. Yeah. Thank you. Many people are answering, but I'm getting still mixed answers. Yeah, Pavitra, Priyadarshini, Divika A, Narmada, Muhammad Usman. Okay, thank you. Like that, you are answering correctly. Some people have also given A and C both answers. Okay, moving to the answer session. That is expanding the thoracic cavity. During respiration, diaphragm, it expands the thoracic cavity. Explanation: the diaphragm contracts and moves downwards. It will be a dome shape. So it's going to contract and moves downwards by increasing the volume of the thoracic cavity and allowing flow into the lungs, allowing oxygen or air flow in the lungs. This is a primary role of diaphragm. What primary role? That is expanding the thoracic cavity by contracting the diaphragm muscle and a downwards movement which increases the volume of the thoracic cavity. That's why I have selected option as expanding the thoracic cavity. Thank you. Thank you so much and all the very best for your MRB examination. A big thank you from entire Excel group of institute. Thank you, dear principal, sir, for giving me this wonderful opportunity. Make use of this series. Have a great future. All the very best. If any kind of queries or doubts, you can contact us through WhatsApp group or through any kind of emails. Thank you. Thank you, Mohammad Irshad.